age with you. It will always look in proportion to your body. Here's another patient. She had some aging issues. She had lost some volume. But what really struck me was the skin. Look at the texture here and look at the texture here. That is just doing it with the stem cells. That's just how the stem cells communicate and tell the skin to rejuvenate. Here's somebody who has a lot of sun damage. She doesn't have a very good jawline. Okay. She doesn't have a very good jawline. Here we did the stem cells. She got her jawline back. Her skin here is much improved, but it's not a miracle. We're not going to go and reverse everything, okay? Her skin is better, but you will not be able to improve the skin and get everything like this by just doing a facelift. Because you would tighten it, you would make it tighter, but all these lines still would be there. Because these are creases in the skin. Lips, when we do the lips, they look good, and we did the laugh lines. So I'm just showing you how some people get less swollen, and some people get more swollen right after the procedure. Here, we can do it in men. In men is great because there's no scars. You don't have to worry about hiding, the hairline and looking different. Men don't like to have anybody know that they've done anything. So we can do the hands. Basically, you can do any body part that you want. So the telltale side of any person is that they do their face and they don't do the hands. So I generally try to match the hands to the face so nobody can tell. The nose, here's someone who didn't like her nose and had a little bit of loss of volume here, and she had everything fall down. And we did her nose and her under eyes, and everything got lifted. Her nose is straighter, but it doesn't look bigger because the proportions are changed. It actually looks smaller than over here. So everything is but proportions, volume. The whole concept is changing to this. And all this without any surgery. I mean, she got off the table and she went. She was my nurse. She went back to work. Yeah. Exactly. And that's how we got to here. By doing all those treatments, we saw how the skin got better. By doing the burn victims and doing the ulcers, we saw that the skin is getting better and it's healing better. And in the laboratory, when we were growing all these cells, we saw that these cells communicate with one another. And when we look back into all the clinical and data that we have, and we look back into the studies done on different things, I don't know if you guys have heard of Lattice and all these eyelash things that they came out. They're basically all because of prostaglandins, okay? They took all these things that the cells produce, and they said, oh, this one does this one does this. And it's all chemical reactions. So here we took Luminesce in the laboratory. The cells that we put in are stem cells. And when you put them in the laboratory, they're talking to each other. When they're talking to each other, they use a language called chemical language. Our bodies use chemical language to talk to each other. Our cells use the chemical language. We use words, and our cells use chemicals. Those chemicals include cytokines, interleukins, prostaglandins, growth factors, and all these basically language materials that were being produced in the laboratory by these cells, we took them and we bottled it. So there's no cell in here. This is not a live tissue, but this is a live product, okay? There's a difference. There's no cells in here, but everything that's in there is produced by a cell. And when you grow these things in the laboratory, no two cells are alike, just like no two people are alike. So every time we grow them, we're going to have different batches. Every time we do a cycle in the laboratory to get these stem cell products, we're going to have a little bit of variation. Not a lot. They're still within the norm. We've tested it to make sure that we have enough of everything. But there is a little variation from batch to batch. And that's why if you look at these things, it may be a little bit redder, maybe a little bit this way.